Hello, hello. Uh, Pardon the way I look. I've been working in the yard today, doing a lot of things, trying to get things in order before we go away for our Thanksgiving family time. But I was looking over my to-do list. There are instructions that I got from the surgeon, from the surgical team, on things that need to be done prior to surgery. So while I was looking over those things, I thought that it would be a good idea to share what that regiment is. Now, keeping in mind that yours is probably going to be different depending on who you are and what condition you have and what your surgical team says, but just to share mine with you. It says 5 days. 5 days before the surgery, I'm supposed to brush my teeth 5 times a day. Now, it doesn't say specifically any kind of toothpaste or that you're supposed to use. It's just more that I'm supposed to brush 5 times a day, starting 5 days before the surgery. And it says this has been shown to decrease pneumonia. So that's what they're saying the purpose of that is. It's saying 2 days before surgery. So 2 days before surgery, drink only liquids for the 2 days prior to surgery. Examples of liquids are Jello, juices, soups, ice cream, Boost, Carnation instant breakfast, anything liquid. So they're saying 2 days before surgery, I can only have liquids. Now also, it says take half a bottle of magnesium citrate. That's over the counter. In the morning of both of those 2 days. So the 2 days that is a liquid diet. In the morning, I'm also going to take half a bottle of the magnesium citrate. We'll have a bottle on day 2 and half a bottle the day before. And it says if I don't have a bowel movement, I'm supposed to call my outpatient coordinators. The day of the surgery, says if I have a oxygen or CPAP machine, I'm supposed to bring it with me to the hospital. Make sure that I have an updated and accurate list of my medications, and bring my medication bottles for the nurse to review. Now that's interesting the way they worded that, because it says bring your medication bottles to review, but it doesn't say that the medication is supposed to be in there. I would assume that you would want to bring the medication if it was in there, but those of you who are on narcotic pain medications, you know that bringing those with you in a setting where you're going to be unaware of what's going on around you, it may be a little strange. But that's what it says. It says bring your bottles for the nurse to review and a complete list of the medications. It says we will provide all your medications. Do not take any of your home medications without a physician or nurse practitioner approval. So it's saying they'll provide all the medications, so I guess maybe the bottles are supposed to be empty. I don't know. Really didn't clarify that, so I guess I'll have to message them on the patient portal, and on a later video I'll let you know how that worked out. Your family will be directed to the family waiting room while you're in surgery. Your surgeon or a member of the team will call your family after the surgery, and you'll go to the recovery room. And then your family can visit you at the recovery room. Then it says you will have many drains. You will have many drains and lines after surgery. Isn't that something great to look forward to? You're going to have holes in your body with stuff leaking out of it. That's just fantastic. So these will include chest tubes, a J tube in your abdomen used for tube feedings and medications over the next several weeks, a urinary catheter. Sounds delightful. In quotations, it says Foley catheter. In your bladder. So there's a catheter that's going to be there. You will also have an IV line and oxygen. Your heart will be monitored through a heart monitor. You may have an epidural for pain control, or patient controlled through IV. Through the IV. Yes, Amber. I agree. It's all a lot. The post-operative recovery. Your medical team will see you daily and inform you of the medical plan for that day. And I'm assuming that's going to be very early in the morning. So nice of them. It is important to be an active participant in your own medical care. We expect you to do the following. Walk 3 to 4 times a day. It doesn't say how far. Sit in a chair during the daytime. Doesn't say how long. I guess, is that for the whole day? Work with physical therapy, occupational therapy if needed. Brush your teeth daily. I'm assuming that means for people who have teeth. I wonder what the procedure is for if you have dentures. Like if you're are you supposed to clean your dentures 5 times a day? I don't know. Decrease, maybe there's a separate sheet for people with dentures. I don't know. Brush teeth daily. This decreases the bacteria in your mouth to help prevent infections after surgery. You're still expected to shower or bathe daily, although I don't know of any hospital rooms that have a bathtub, but I could be wrong. Cough and deep breath working with the respiratory therapist. And learn how to take care of your J-tube and how to use it. Final pathology reports will be available in approximately 5 to 7 days. And you may be discharged without having the final pathology. So those are the surgery notes that they have for before and during the hospital. That's just the sheet that I got from the surgeon when I met with the surgeon, the one and only time that I met with the surgeon when we decided to do this surgery. This is another thing. I had a telephone appointment this morning with my anesthesiologist to go over, everything, dot all the I's, cross all the T's. And they said that I should get this. It's not the brand name, but if you'll see that chlorhexidine, whatever it's called, that is a surgical antibacterial scrub. And so they said that 3 days before surgery, I am supposed to, when I shower the regular way. And then after I've bathed the regular way, I'm supposed to lather up with this, excluding my face and groin area, if you catch my drift, because this is supposed to be too strong to touch the boys. So, and I'm supposed to leave it on for 2 minutes. So this is supposed to help keep away from infection during the surgery. So that's the instructions. None of this is going to interfere with Thanksgiving. That's a good thing. Thanksgiving's tomorrow, and I plan on thoroughly enjoying that with the family. But once I have been using this stuff, maybe I'll make a little short video and let you know how that goes. And during my hospital videos, if there's anything else that kind of popped up, I'll try to remember to throw that in some of my first post-op surgery videos. So I hope you guys have a great Thanksgiving. Enjoy the time you have with your family and friends. Time is it's a very precious thing, and so are the people in your lives. So I hope you're having a good day. Enjoy the day you have.